Hello everyone, in this video we're going to be talking about Celecoxib. Celecoxib is a medication that is going to be used to treat osteoarthritis as well as rheumatoid arthritis. It is going to inhibit the COX-2 pathway over here. And when it inhibits the COX-2 pathway is mainly known to play a role in inflammation, unlike the COX-1 pathway, which can have a much wide variety of functions. So one of the reasons why we use celecoxib instead of NSAIDs, which inhibit both the COX-1 and the COX-2 pathway, is the fact that it is going to serve to protect the gastric mucosa. So with NSAIDs, they also inhibit COX-1. And remember, if we're inhibiting COX-1, then we're also going to be producing a lot less prostaglandins. Remember that prostaglandins are really important to protect the gastric mucosa. So if we have very low levels of prostaglandins, then that can ultimately lead to gastric bleeds. Now, some of the side effects of celecoxib include thrombus formation, and the reason for this is because we're only inhibiting the COX-2 pathway, so the COX-1 pathway is still going to be active with celecoxib. As a result, we're going to still produce thromboxane over here, and remember that thromboxane plays a role in platelet aggregation, which can ultimately lead to a thrombus formation. Another side effect that we need to be aware of with celecoxib is that it is a sulfa drug. So if the patient has a sulfa allergy, then we're not going to be able to prescribe celecoxib.